Hi, I'm Dr. Julie Steinauer. Today's video is going to be fun. It's an unboxing of sorts. So we're going to share with you the equipment that we use for our patients in our vision therapy program. Now, not every program is the same, so some patients get all of this and some don't get everything. They get just pieces of it. But if you're doing the full 45-week program, which ends up being about a 15 to 16-month program with our phase 1 attached, this is going to show you today kind of the equipment that you're going to use. Now, before we go into that, let me tell you how you can connect with us. If you're local, call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com, and you have two choices. You can either schedule a consultation to talk with me direct about your vision problems and how we can help you, or you can do something kind of more of a generalized approach, which is answer some questions. They're not going to be highly specific. They're going to be more generalized. And then you're going to get some general feedback also. Okay, let's get to our unboxing. So now there's all kinds of goodies in here, and I just want to share with you some of the things that you get whenever you're working in the clinic with us. So first of all, a Brock string. Now, what goes along with the Brock string is a pair of red and green glasses. They're going to be unboxed in a minute because I know they're in here. We also have these really fun and silly looking towel tubes, if you can see those. Camouflage, awesome. Okay, but this is an activity that we use to teach you how to be binocular and using the two eyes together. And then there are a series of what we call lens flippers. They're accommodative or focusing flippers. There's also prism flippers. This one happens to be a prism. I don't know if you can see that. Let me try and put it over here. But you might be able to see how it's thick on one end versus the other. Those are the prisms. And they help teach you how to align and use your two eyes better together as a team. There are also extra cards here that go with, I think that one goes with the bernelloscope, which we provide to patients. We also use something called the peripheral recognition chart. It looks like this. We teach you how to have wide awareness of your periphery. We have a Snell and eye chart that is made for our patients, and we teach you how to measure your visual acuity with that. Then there's a red and green chart that can be used with the red and green glasses. That teaches your brain not to cancel out or ignore or suppress an eye that you might be struggling with binocularly because of amblyopia or strabismus or some other situation causing you to suppress the eye. And then there are a series of various notebooks, which everybody gets different notebooks depending upon what age you are and what your visual problems are. But these are there are quite a few different workbooks that we utilize for our patients. And then this is like, okay, I'm making a mess over here. My pile's getting big. This is kind of like a little goodie packet. It's got red and green glasses, a barrel card, and a lifesaver card. There's a pen light and an eye patch in here, as well as a couple different types of what we call occluders. So occluders, there is one set, if I can get them separated. Here we go. One set that looks like this, where we teach you how to put them in front of both eyes and do some stretches with the eyes. Then there's another set that are called translucent. You can kind of see, let's cover the camera up with that one. Oh, you can't see through that really well. It does, if you're wondering what those little scratching lines are, it does have a frosting that covers it to protect the filter until the patient gets it. Here's one that doesn't have that crazy frosty, but look at that. And obviously this one, you can't see anything through. It just covers up everything. So those are some occluders that we give to our patients. And then we also use something called an aperture rule, which this one is not put together. It's kind of like, it looks like this before you put it together. And this is used to help train our patients how to have better binocularity. Let's see, what else? We're getting down to the end of our box here. Oh, if I can get this one out, it's a little bit tricky because it is a big box. All right, here we go. Ugh. Okay, so this one is called a bernelloscope. And it is not totally put together, but you get an idea of what this thing looks like when it is put together. It's like this little tool that we use. You look through here, there's some cards that go on here on a stand, and we can train you how to have better binocularity using it. So that is a great tool that we use for our patients. The bernelloscope, I'm going to leave that sitting out because it's so hard to get back into this. And then these are a series of other lenses. Now these are the focusing or accommodative flippers. Let's just see if I can, here we go, are you ready? Let's see what happens if we go like that. Whoop. It makes everything smaller, but it's kind of hard to tell that, and I don't know if you can see that. There we go, that's a lot easier. It makes everything bigger, and this one makes everything smaller. There we go, perfect. So you can see there's a series of these that we give to our patients in order to train them how to have better binocularity, focusing skills, and all of that. So we unboxed some things today. Now, if you are interested in learning more about what our program looks like and how it can help you, I would urge you to give us a call. If you're local, you can call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com. Two choices. You can either fill out a questionnaire and get some generalized feedback about the questions that you answered, or you can schedule a consultation directly with me if you're serious about stepping forward and finding out what kind of treatment you need in order to resolve your visual problems. Now, like this video if you haven't done so already, we would love that. Please make sure that you're subscribed so that you don't miss any of our videos, and as I always end them, if you feel like this would be useful, helpful information to pass on to someone that you know, please pass it on. Thank you.